50 Advanced Anatomy and Physiology Q&A. 1. What is the functional unit of the kidney? The nephron, consisting of the glomerulus, tubules, and collecting duct. 2. Which cranial nerve controls facial expression? The facial nerve, cranial nerve 7. 3. How does the sodium-potassium pump work? It moves 3 Na ions out and 2 K ions in, maintaining membrane potential. 4. What is the Bohr effect? A decrease in hemoglobin's oxygen affinity due to increased carbon dioxide or decreased pH. 5. How to calculate cardiac output? Cardiac output equals stroke volume times heart rate. 6. What hormone regulates water reabsorption in kidneys? ADH, antidiuretic hormone. 7. Which part of the brain maintains balance and coordination? The cerebellum. 8. What is the difference between afferent and efferent neurons? Afferent neurons carry signals to the CNS. Efferent carry signals away. 9. Which cells produce myelin in the CNS? Oligodendrocytes. 10. What is the primary pacemaker of the heart? The sinoatrial, SA, node. 11. What is the function of surfactant in the lungs? It reduces surface tension, preventing alveolar collapse. 12. What does the renin-angiotensin-aldosterone system, RAS, do? Regulates blood pressure via vasoconstriction and fluid retention. 13. What is a motor unit? One motor neuron and all the muscle fibers it innervates. 14. What is the role of the hypothalamus? Controls temperature, hunger, thirst, and hormone regulation. 15. What are the 3 layers of a blood vessel wall? Tunica intima, tunica media, and tunica externa. 16. What triggers ovulation? A surge in luteinizing hormone, LH. 17. What is the function of bile? Emulsifies fats to aid in digestion. 18. What is the function of the loop of Henle? Concentrates urine by creating a salt gradient. 19. What enzyme starts protein digestion? 19. What enzyme starts protein digestion? 20. Which blood cells combat parasitic infections? Eosinophils. 21. What is the function of the sarcoplasmic reticulum? Stores and releases calcium for muscle contraction. 22. What is the refractory period in cardiac muscle? A time when the heart muscle can't be re-excited, preventing arrhythmias. 23. What is the role of T-tubules in muscle contraction? They transmit action potentials to the interior of muscle fibers. 24. What is the function of the thymus gland? Site of T lymphocyte maturation. 25. Which hormone increases blood glucose levels? Glucagon. 26. What is the main function of platelets? Blood clotting, hemostasis. 27. What are the main types of muscle tissue? Skeletal, cardiac, and smooth muscle. 28. What's the difference between systole and diastole? Systole is contraction. Diastole is relaxation of the heart chambers. 29. What does the P wave on an ECG represent? Atrial depolarization. 30. Which vitamin is essential for calcium absorption? Vitamin D. 31. What is the function of alveoli? Site of gas exchange in the lungs. 32. What type of joint is the shoulder? Ball and socket joint. 33. What organ produces insulin? The pancreas, beta cells of the islets of Langerhans. 34. What structure connects muscles to bones? Tendons. 35. What is hematopoiesis and where does it occur? Blood cell formation in red bone marrow. 36. What does the QRS complex indicate on an ECG? Ventricular depolarization. 37. What is the function of cerebrospinal fluid, CSF? Cushions the brain, removes waste, and delivers nutrients. 38. What part of the brain controls breathing? Medulla oblongata. 39. What is the function of the lymphatic system? Maintains fluid balance, absorbs fats, and defends against pathogens. 40. What is the function of hemoglobin? Transports oxygen and carbon dioxide in the blood. 41. Which structure stores sperm? The epididymis. 42. What type of immunity is provided by vaccines? Artificial active immunity. 43. What hormone regulates circadian rhythm? Melatonin. 44. What is the largest organ in the human body? The skin. 45. What type of connective tissue connects bones to bones? Ligaments. 46. What is the role of the corpus luteum? Secretes progesterone after ovulation. 47. What is the primary site of nutrient absorption? The small intestine, mainly jejunum. 48. What is the function of baroreceptors? Detect changes in blood pressure. 49. What part of the nephron reabsorbs most glucose? The proximal convoluted tubule. 50. What is the role of acetylcholine at neuromuscular junctions? Glucagon triggers muscle contraction by stimulating muscle fibers. Thanks for watching. Don't forget to subscribe.